one of my friend presented me a book on research methodology where she was the author. So in 2012, in fact, I knew her, but I had never seen her. But I never knew that 6 years after, I will be working with her in the institution in AIIMS Bhubaneswar, and for where I'm nearing close to 3 years in this place. So thank you very much, ma'am, for accepting my request and joining today and sparing your valuable time and sharing your wisdom with all the attendees. The second speaker is Dr.Deepraj Bhandarkar. He's a good friend of mine. He's a very nice minimal access surgeon. He does excellent laparoscopic surgery and thoracoscopy in Hinduja hospital in Mumbai. Apart from that, he had single-handedly was handling the prestigious journal on minimal access surgery, the JIPMER, for nearly 12 to 13 years. Just 2 months back, the new editorial team took over, where in fact I am privileged to be part of that editorial board. And now Deepraj is the chief editorial advisor to the journal. He was in fact instrumental in the first laparoscopic surgery that happened in the entire Asia Pacific region with Professor Hampton Woodwardia. He was in fact a very young resident, a registrar that time with Professor Woodwardia. And in fact, I have the opportunity of working with him in the Minimal Access Surgery Revision Committee guideline formulation. And Deepraj, in fact, many good surgeons are not good surgical teachers, and many good surgical teachers are not good surgeons. But to get both in one person is surely Deepraj. He is an excellent surgeon and a fantastic teacher as well, a passionate teacher. So the next is our moderator of the evening is a very young man with vast experience. He is Dr. Sitanshu Sekhar. He is additional professor in CMFM and associate dean research in JIPMER in Puducherry. I in fact know Dr. Sitanshu from his intern days when I was a lecturer in surgery in SCB and he was an intern. Later on, he became my relative. His wife and my wife, they're relative. So Sitanshu is, though young, has got vast experience in medical education and research. He has got many honors and research affiliations. He's a totally family man. So Sitanshu has got many orations, everything in his credit. So thank you, Sitanshu, and thank you, Deepraj, for spending your valuable time. And going ahead, we'll be in this spring, the next week, same time, we'll be having tips and tricks on open bilioenteric and pancreatic enteric anastomosis by Dr. Adarsh Chaudhary from Medanta Medicity Hospital in Delhi. So it's a weekly event. It will continue till I think it should continue because I've getting many requests to continue this event, and probably people are also getting benefit from many faculties. So without wasting time, I will now hand over the entire session to Dr. Sitanshu. Dr. Sitanshu, the screen and air, everything is yours.
Thank you so much, sir. Thank you for that lovely introduction. I didn't know that you got the photographs from the Facebook. So Facebook, everything is open nowadays. I didn't send all these things to you, sir.
You did not send me anything. I've got all the photos of everybody on my palm.
Yeah. So good evening, everyone, and it is a pleasure to be with you today evening. And amongst two esteemed speakers, Dr. Gitanjali is sort of my mentor, where we started medical education under her guidance and a leader par excellence. So before we start and hand over the session to ma'am, so let me just introduce the topic, what we are going to do now. So the word science is derived from the Latin word known as scienza, meaning knowledge. The term research stems from the French term called recherche, meaning to go about and seeking for or search. So scientific research refers to a systematic and critical evaluation of questions about a presumed relationship of an observed phenomena. So research everyone does, but the issue is we don't publish it. The problem with that, so today's webinar is actually an apt webinar for all of us. Surgery or any other specialty, people should take effort to take their research work into a logical conclusion, what we call as a research paper. A research work carries meaning when it becomes widely known to the scientific community, Seeing one's name in PubMed or Scopus or Web of Science database gives immense pleasure and fulfillment. So in that regard, but the journey to reach that stage is not very smooth. The path is full of ups and downs, frustration and satisfaction, and sometimes depression as well. But the reason for that is we don't follow a systematic way of writing the papers. So today we are fortunate that we have two stalwarts present amongst us, Dr. Gitanjali ma'am and Dr. Deepraj. So without any further ado, let me hand over the mic or the stage to Gitanjali ma'am for her talk on this. But before that, some rules, because every time webinars and other things, what happens, we must tell some rules. Please keep your mics mute. If you have certain questions or some comments to ask, please write it in the chat box. If time permits, we'll allow you to ask your question into the live to our expert person. And now I request Dr. Gitanjali to talk about formulating research question and research project. Ma'am, the floor is yours. Thank you so much.
Good evening, everyone. So, first of all, I would like to thank Dr. Manash for inviting me here. And I'm actually, why is it not sharing? Okay, just hold on. We tried it and...
Ma'am, you click present now, then select.
No, I tried it. Okay. I think it should come on.
Yeah,
Is it come?
Yes, ma'am.
Yeah. So, okay, something is blocking me from coming to presentation mode. What is that? F5? What is the thing which you press? F5?
F5, yes, ma'am.
Yeah, okay. Okay, is that seen? Yeah, okay. So first of all, I would like to thank Dr. Manash for inviting me here. And he knows that these are, I mean, talking about scientific writing is one of my pet subjects. So I love talking about scientific writing. And I'm sure Sitanshu would have heard this many times over. But I think that, even if you keep listening many times, there will be always something which you pick up from different speakers. So I'm going to talk to you a little bit about formulating a research question. And this is a talk which I prepared for another webinar a few weeks ago. So I don't know whether some of you have heard it. So this is a repetition of that. So formulating a research question, my outline will be first, of course, what is a research question? Why is it important? Then we look at how to frame a good research question. What do we usually do wrong? And so these are the 4 things I'm going to fit in today's talk, which will be around 20 minutes. And I am making a declaration that this is not about how to get an idea for a good research question, because that is an entirely different thing. How to choose a good topic for research, this is not that. This is about formulating the research question in your paper. So this is what my talk today is going to be. It's not about the other aspect of how to get a good research question. Okay. So basically, a research question is at the tip of a small pyramid or whatever you want to say, because the topic is the base. You need to choose a good research topic, and then you slowly narrow down things until you get a good research question. So you must understand that a lot of work will go in finding a topic, narrowing it down, focusing more and more until you get the research question. So that purified element will be the research question. So now the question is, what is a research question? Of course, most of you will say that, if you are going to ask a question in research and you're going to answer it, that is what it is. So it has a slightly more complex definition. It is a clear, concise, focused, complex, and arguable question. So these are the adjectives it has. That can be challenged, examined, and analyzed to provide useful information. So if you look at it, it is very clear that the question you are going to ask is not a simple yes or no thing. It is a complex question, and by its very nature, it is something which you need to study or do some more work or ask some more questions in order to collect information so that you can provide useful information which you are asking in that question. So it is not a very simple thing which we can say is a research question. It is fairly complex. So then the question will be, why do we need a research question? Why at all do we need a research question? A research question is very essential before you start doing the research. Before starting out on any research, you will need to have a research question. Why? Because it helps keep your work on track. This research question is like a guide. It will prevent you from going here, there, everywhere. It keeps you on track. A thorough research process and even a well-written scientific paper cannot compensate for a bad research question and the subsequent bad design. So if you have a bad research question, you will produce a bad paper. Even if you write it fantastically well, do some very good statistics and all that, because a poorly written research question will lead to a bad design. So one of the things which you must realize is a research question must be included in the research protocol. So this is, you need to put it into a research protocol. In every protocol should have a research question. Okay. So this is something which most of you will already know if you have already sent a paper and it has been rejected. Apart from the fact that many papers are, editors reject papers because they are out of scope or they are very poorly written or, for various other reasons. But there are three reasons why editors reject papers. One is that the research question is not new, it is not interesting or important. The second one is the design and methodology is not optimal. So poor methodology, you can expect it to get rejected. And lastly, the research is not reported effectively. So the research question is a very important aspect of why papers are not accepted. You must have seen in some journals, they ask what is already known on this topic, and there will be a small box which says you have to explain what is already known on this topic. There is another box which says what this study adds. So if you are already doing a paper or you are writing a paper or you have done some research on work which is not new or which does not add any new knowledge, it's not going to get accepted. So that is the reason why we say that you must raise a good research question. So this is an old paper by Ian Chalmers, and I thought this would be interesting for us to know. In the x-axis, if you plot relevance to immediate application on the x-axis, so from low to high, and then on the y-axis, if you have relevance to advancement of knowledge. Okay, so if you have this on the x and y axis, obviously you will have 4 quadrants. Okay, now if you look at the upper right quadrant, you will find that this is use-inspired basic research to address important practical questions, high value, and easily it will get published. For example, that is why you are having so many things on, the COVID-19 way in which it is infecting cells, and, about the vaccine research and so on. So that is called the pasture quadrant. If you produce a paper in which the question belongs to this quadrant, it will definitely get accepted. If you might have some pure basic research which is done without any consideration or relevance to practical issues. In foreign countries, this is the quadrant where you get a lot of funding. You might have another quadrant which is called a Dole quadrant. Dole stands for Richard Dole, who did the early studies regarding smoking and lung cancer. Okay, so this kind of research, it's difficult to publish, but he kept on at it, and then people realized the importance of applied research to address important practical questions. The reason I'm putting that is, if your question falls in this waste quadrant, forget it. It's going to be very difficult to publish. So if you are raising a research question, you must think of being able to publish. Okay. So developing a research question, you can't just get up from bed and write a question and say it is there. It is an iterative process. You need to keep on working at it over and over and over again. 3 key ingredients: you must have scholarship. If you are a student, you may not have it immediately, but you can keep on reading and learn about the subject. You must have experience. That is why you go to a guide, or your guide has the experience to be able to guide you. And if you have 1 or 2 mentors, that will be very good, because they'll be able to also give you some information, input, and guidance. Qualities will be creativity, tenacity, and judgment. You might not get all 3 at the same time, but if you work at it, you will slowly become better and better. So developing a good research question requires all these 6 things. Now, what are the qualities of a good research question? Obviously, it has to be well stated. Its focus must be very narrow. As I told you, that there is this triangle. So you are looking at the tip of the triangle or pyramid, whatever you call it. So focus should be very narrow. It should be specific and restricted in scope. If it is extremely wide, it is not a good research question. It will identify exactly what is to be solved. It is testable, and it should not pose an ethical problem. If it poses an ethical problem, it will be difficult for you to get the permissions to even do it. So make sure that there is no ethical problem there. So finding the right research question is the first step in successful publication. That is one thing which you must remember. So you have to begin with the end in sight. What is the end? It's the publication which is the end. So you need to begin thinking about whether you'll be able to publish it by asking the correct research question. Just one moment, please. Hello? Hello? Sir, I'll just call you. I'm on a webinar. I'll just call you after a few minutes. Yeah. So the essential characteristics of a good research question is a acronym called FINER. Okay. So what does FINER stand for? FINER stands for feasible. That means, do you have adequate cases or subjects? Do you have the expertise to carry out this study? Do you have the time? Do you have money? So you need to see, you might get a wonderful research question, but if it is not feasible, you cannot do it. So these are the characteristics of a good research question. Some people say it is the characteristics of a good research problem. So one is F stands for feasible. I stands for interesting. It should be interesting not just to you. You might find something extremely interesting, but your peers also should find it interesting, so that it will get published, so that people will read your paper and they will be interested in the work you are doing. It should be novel. It should be ethical. We covered this already. And it should be relevant. Relevance to what? Will it advance scientific knowledge? Will it change policy or practice guidelines? Will it guide future research? It should be relevant. There is no point if we in India are sitting and doing work which is relevant to somebody in, Antarctica or something like that. So we need to do research which is relevant to our own people, which is of, especially if it is of immediate relevance to policy changes or bring about changes in the way in which we practice medicine, it will be very good. So these are the characteristics of a good research question, which is this thing with the acronym FINER: feasible, interesting, novel, ethical, and relevant. Now there is one more, and this is called the PICO framework. PICO framework. And what does PICO stand for? It's an acronym which stands for population, intervention, or exposure. Some people call it PECO. So I stands for intervention, or it can stand for exposure. C is the comparator or control. O is the outcome, and T is the time. So this is called a PICO framework. So why should we have this framework? Generally, it is said that if you have a question, a research question, which follows this framework, you will probably have a good quality of a question. So let me tell you about this PICO or PECO. So among the people with specific characteristics, you define the target population. Does a specific particular intervention, that is the I, in comparison to a specific alternative intervention, usual care or placebo, result in altered outcomes at a specified time. So this is what a PICO question is. So you have the target population. Can a particular intervention in comparison with a specific alternative intervention result in altered outcomes at a specified time? So this is how I can explain this PICO framework. If I'm giving you an example for that, look at this. So supposing among people in the subacute phase of stroke, so what will the population be? Population are the people in the subacute phase of stroke. Does a moderate or high degree of depressive symptomatology. So that's the exposure. Depressive symptomatology, moderate or high degree of that will be the exposure in comparison to low degree. So what is a comparator? Comparator is a low degree of symptomatology. Ready? Community participation, which is the outcome. So outcome is community participation and 6 months post-stroke. So that's the time interval. So as you keep working on it, you will become better and better. So this is just an example of a PICO of a question which follows the PICO framework. So the research question sets out what the investigator wants to know, not what the investigator might do or what the results of the study might ultimately contribute. So you have a knowledge or a gap or a clinical dilemma. If you use the PICO and FINER criteria, it will lead you to a good researchable question. So you may ask me, why should we use PICO? It has been proved that if you use PICO to frame a research question, so that is independently associated with better overall reporting quality. The effect is small, but reporting quality improves. And secondly, it is a consistent format for developing good answerable researchable questions. So when you write one, it is easy for you to get a good question if you're following this, okay? And it's also easy for you to evaluate the evidence. If you're looking at evidence-based practice, people use a PICO format to ask good questions, okay? So for these reasons, it is always prudent to use a PICO framework. Now we'll come to which type of scientific papers do you see a research question. Many times when you read a paper or you see a paper or you write a paper, it may not even have a research question. But there are some scientific papers in which you see a research question. Always you will find them. Systematic reviews will have a research question. Meta-analysis will have a research question. Sometimes qualitative research designs also, you will find a research question within the paper. And usually where will you find it? It will be in the introduction or in the abstract. That is the place where you will find the research questions. Now it has also been studied that about 30% of the research questions that were stated need to be reworked. They are not very well written. So this is an example of a research question in the abstract. So this this journal chest, in the abstract, there is a place for a research question. So this is the research question in this paper. It is, as I said, it is a systematic review and meta-analysis. So that is written in the abstract itself. Now, this is another paper which is from the Journal of Occupational Health and Rehabilitation. And in this, this research question was stated in the introduction part. Okay. Now, this is another journal where in a clinical trial, usually in clinical trials, mostly you will find a hypothesis. Here, the research or objectives will also be there. Here, the research question is stated, as you can see, in the introduction of that paper. So, some papers do mention a research question, do state a research question. So, what are the common errors? One is sometimes you are not very clear about the parameter linking exposure and outcome. So your research question doesn't actually make a lot of sense. Second thing is nobody cares about your research question because it is of poor quality and it is not of interest to anybody. Sometimes what happens is I have seen a lot of people saying, I have a lot of clinical data. I have a lot of clinical data, and you try to make a research question to fit your data. So that's not a good thing. Okay, you should always start with the question and then get the data, not have clinical data and try to prepare a question. Now, fourth thing is data dredging. Data dredging means you have data and you keep doing all kinds of, statistical tests until something comes out positive, and then you really don't know what question it is answering. The last is to have a research question which can be answered with a simple yes or no. So these are some of the common errors which are found in formulating research questions. Now I'll give you a few tips. A good research paper will address a specific research question. Now this is a mistake people make when they do a thesis or a dissertation. It is the body of work is slightly large, and then they try to answer many questions in one paper. So that doesn't become publishable. So you need to select publishable amount of data and write a paper for that. So the research question or a study objective or the main hypothesis, this is the central organizing principle of the paper. Whatever goes into the research question goes into the paper, whatever doesn't is out. So this is something which you can easily keep in mind. So I'll just conclude by saying that the research question is a pivot around which research should be planned and a paper written. The PICO framework and the finer criteria, they will help to refine a research question. So whenever you are writing a research question, keep these two in mind. And if you formulate a good research question, the quality of the work which you do is also improved, as well as the reporting. Both are improved if you have a good research question. And lastly, the quality of research questions in published papers needs improvement. If you see, you can take a few papers and see many of them, the research question is not very well written. So with this, I thank you very much, and I will be happy to answer any questions if you. Thank you.
Thank you so much, ma'am. That was, as usual, it's a pleasure to listen to you and always something new to learn from your presentation, and the way the slides are made so crisp and so clear, concise. So we'd like to have some questions. I just saw in the chat box, there is one question. Dr. Gaurav Das wants to know, does every study have research questions?
See, every study must have a research question. That's what I will say. Every study must have a research question. It can have other things. That is, it will have objectives. It can have a hypothesis. But you must have a research question for a study. Yes.
Yes, so that's the answer, Dr. Gaurav. And Dr. Sushant wants to know how to search a database to find good articles related to the research question.
No, that comes under literature search.
Literature search.
Yeah, that comes under literature search. So that's out of the purview of this. Yeah, that is a maybe 2-3 days webinar how to do a good literature search. Yeah.
Yeah, maybe if Dr. Manas wants to take it up for the further.
A little bit, Dr. Kar. I'm going to be touching upon literature search in my talk.
All right, sir. All right. So now, but what I want to say, if there is another chance of doing such webinar, then literature search can be one of the topics to discuss. That's a very, very important area.
I think there is one more question. Is it similar to aims and objectives? The research question, is it similar to same aims and objectives, ma'am?
No, it is not similar. See, a research question is a question. And aims and objectives are not. Aims and objectives have an entirely different thing. See, a research question is what you want a person to do, the question you want answered at the end of the study. Aims and objectives will tell you how you are going to get it done. So there is a big difference between aims and objectives and a research question.
So that means the research question is equally important in writing a paper, whether you take up a project. It's equally important in both the scenarios.
It is important in both the scenarios, but as I told you, many papers do not explicitly state a research question unless it is a systematic review or a meta-analysis or qualitative things. Some clinical trials will this thing, but a research question is not stated in a publication, in the paper, But definitely in a research protocol, you need to put it in.
Ma'am, what's your message for the surgeons in this forum? I mean, surgeons actually, they do not bother much for writing a paper. They only know how to cut and stitch. They hardly bother whether you are writing a good paper or a bad paper. So, I mean, what message you want to give the younger colleagues or younger surgeons who want to write papers, but they are lost? Where to start? How to frame a research question? What has to come into their mind?
See, you have to keep writing. Nobody writes a paper first time out and, you write well. So the issue is whether you want to do it. I personally feel that if you are an academic in an academic institution, this is the currency by which your progress is judged. If you are appearing for an interview, people look at your publications. So if you can't say that, I'm a surgeon, I like to only cut, I don't care about writing. If you are in academics and if you are going to enter into a academic milieu, then you'll need to have some publications. So you get away from this.
Yeah, I just wanted to add another thing to this. Even apart from being in an academic institution, probably one thing where a surgeon is well recognized is the amount of publications that he is putting in, because the quality of work is well manifested when you write a paper and that paper is peer reviewed and you get to know where actually you're going and doing things wrong and how best you can improve still further. So I think I also consider people not in academics as well to get involved in some kind of a paper writing. What's your take, ma'am, on this?
See, it is good, but again, it is a question of interest. See, let me tell you that scholarship doesn't mean only writing original paper. Scholarship could mean that these people might contribute to guidelines. They might contribute to consensus statements. So there are various ways in which you can, you can be, your scholarship can be acknowledged. That's what I would say.
Absolutely.
Ma'am, if there are no further questions, I think ma'am also got a call in between and she's quite busy for her time. So I think thank you so much for ma'am for that wonderful session. And yes, Dr.
Thank you so much.
It was nice. Nice seeing you, and I'm seeing a lot of our faculty. Most of our faculty are here. Madhav and Arvind and a lot of faculty, Satyabrata, and
so many faculties from outside also are there. There are few overseas guests, colleagues are also there on the forum. So it was, thank you very much for sparing your time and sharing the wisdom.
Thank you. My pleasure. My pleasure. Thank you.
Thank you, ma'am.
So from research, formulating research question, now we move to the next session. And it's my pleasure to invite Dr. Deepraj Bhandarkar sir to take the floor and try to give us some idea about introduction to how to write medical papers. So the floor is yours, sir. Please.
Good evening, ladies and gentlemen. Am I audible and is my screen seen?
Yeah, your screen
Yes,
is
yes.
very well seen, Deepraj, and you're very clearly audible. So
Okay, thank you. Thank you very much, Manash, for this kind invitation to be amongst you today. This is probably one of the late webinars that I have attended during these past 6 months. You know, the usual webinar time is evening time. Some of them happen in the morning. And I admire your enthusiasm and the efforts that you're putting into this series of webinars, which will help all the participants, and all the best for your future activities also.
but in the process, I am also getting enlightened and getting more knowledge and knowledgeable as well.
That's very kind of you to say. Okay, so I have no disclosures for this talk as such. The only disclosure I have is I had requested Manash that writing a medical paper is a topic which requires some deliberation, and it cannot really be completed, or it cannot be covered in about 20 odd minutes. So I had requested him the liberty of talking for about 40-45 minutes. I've tried to cut down this talk a lot from what I had originally prepared. But please indulge me at any stage if you feel that we are overshooting or if we need to wind up. I'll summarize the things from that point forwards, and we will close down. I can understand it's getting late. It's getting to people's dinner time, etc. So I don't want to be the person standing between that and their evening dinner or relaxation.
I think because you can comfortably take us up to 9 o'clock, absolutely without any problem. Please.
Okay, thank you, Manash.
Please.
Right. So what are we going to cover today? I think the talk which Madam gave was an excellent one. She touched upon how does one formulate a research question, what research is, how do you go about it. There is a whole separate section that we can conduct on the actual research methodologies. But what we'll be restricting ourselves today are these few questions. Why should we write? Do we start writing right away the moment an idea comes in our head? Or what are the steps that we need to take before starting the writing process? How do we write? What are the structure or what are the parts of a paper? And in this respect, I'll be restricting myself more or less to an original article. There are many other forms of types of articles which can be written, but original article is the most comprehensive one, which has all these different items in them. So we will focus on that. What do you do once you feel that your manuscript is ready as a writer, as an author? What are the certain precautions that one needs to follow even before finally submitting or uploading the manuscript to a manuscript management system of a journal? And how does one manage the manuscript after it has been submitted to a journal? So these are the things that we're going to go through. I still remember the day I got to see my name in print in Indian Journal of Surgery in January of 1990, when I had written and submitted a first case report. And it is what you may want to call as the author's high, or that pure delight that you get out of seeing your name in print is to be experienced, to be believed. So there is always something to be said about taking up this endeavor of writing a paper. But let me warn you that this is challenging. It takes serious efforts to be able to do it well. And as so many other things in our life, this is purely an acquired skill. as Madam very rightly said, you cannot just get up one morning and expect to churn out a paper which will get accepted. So in a sense, what I'm trying to tell you is that if you stay with me for the next 40-45 minutes and be on this journey with me, I can tell you that this is not going to be easy. But at the same time, I can promise you that this is going to be a worthwhile effort if you persevere with it, if you put in the efforts and come out victorious at the top. So let us see why we should write a paper. This is an excellent book by a gentleman by the name Simon Sinek, and you should pick it up and read it. So the title of the book is very catchy. It says, start with why. Anything that you wish to do in life, it does not necessarily apply only to writing. Anything, any goal which you feel you want to pursue, start with this fundamental question of why you want to do it. And if you can dig into yourself and find the answer to that question, I think the subsequent process of the hard work or the struggles that you go through in accomplishing that all become worthwhile. So if we apply this question to writing, why should we write a medical paper or a scientific paper? You can look at it from three perspectives. You write it for yourself, as has been said before, to advance your career. Disperse your ideas. You may have an idea which you want to communicate to the rest of the scientific community, and that could be a very noble goal, motive in itself. And the bigger picture is you're contributing to science. You're leaving your mark on the science in some small or big way. What about your colleagues? You can do something or preach something that you can hope will change clinical practice in some small or a major way. And finally, why do we do all this? It is simply for our patients. So if you write something, it could be something as simple as a technical modification of a technique which is commonly used. And today with the internet, with the electronic media, a surgeon sitting thousands of miles away reads that paper and uses your technical modification to help his patients. Your efforts, your hard work in writing that paper would have been worthwhile because you have indirectly helped a patient or patients sitting or in a hospital thousands of miles away. So these are the reasons why one should endeavor to write a scientific paper. Before we jump into the structure of a paper or what constitutes a good paper, this quote comes to mind from Abraham Lincoln. And he had said that if I had 6 hours to chop down a tree, I would spend the first 4 hours sharpening the axe. Or in other words, if you spend time in deliberately preparing yourself, getting geared up towards that writing process, your writing would be that much easier and also more enjoyable. So what are the things that we need to keep in mind before we start writing a paper? First of all, you need to figure out the idea that you have or something that you have to say. Which type of format of paper does it actually fit into? Second, which journal would you want to target? This is an issue. This is one point which people often do not pay enough attention to, and then they struggle in getting their paper published. And finally, we'll touch upon the literature search part of it, which is something that you need to do before you start writing a paper. So this is not an exhaustive list, but these are the commonest types of medical papers that you see in a medical journal, starting with letter to the editor, images in surgery, case report or case series of a few cases, technical reports which highlight and focus on a technical modification of a particular surgical procedures, original articles, randomized trials, review articles, systematic reviews, meta-analysis, and finally the editorial. So if you go from the top to bottom in that order, this reflects the easy spectrum to the difficult spectrum towards the bottom. And also, on the other hand, you can say that some of the types of papers in the upper half are for the beginners, and the editorials, the systematic reviews or meta-analysis are for the experts in that particular field. So this is something that you need to keep in mind. Don't get up one fine morning and say something like an editorial and shoot it off to a journal in the hope that it will get accepted. Editorials are more often than not invited editorials, or they are written by people who have considerable and years of experience in that field. So let us now look at how does one choose a journal for submission. I have made this section fairly elaborate for the simple reason that you need to understand that the process of submitting a paper to its peer review often takes a few months. So to begin with, if you've not chosen the correct journal, the chances are that the paper is going to bounce from one journal to the other, and that is going to lead to frustration. So spending some time, giving it some conscious thought in choosing the journal often will avoid that frustration. So you need to ask yourself these questions. What is the target readership? What kind of submission do I have? What is the type of submission that I have? We'll discuss a little bit about the impact factor and the indexing of journals, which are two terminologies which get thrown around quite a lot. Something about the article processing charges, the fees that certain journals charge for publishing your paper. We need to also look at the number of article types per issue. We'll come to that in a minute. And finally, what is the submission to publication time in that particular journal? So this is where you need to be a sort of Sherlock Holmes and do some research and do some digging around to figure out what would be the common or average submission to publication time in a journal. I've just taken random examples to make a point that you need to identify who your readers are. Who is that paper meant for? Is it for a generalist? For example, at the left end of the spectrum, I have kept JIPMER, the publication of the IMA there, which goes to all its members, including a whole lot of family physicians. Is it for a specialist? JAPI. I've taken medical examples here, not surgical examples. So JAPI is the journal of API, the Association of Physicians of India, read by almost all physicians. Are we talking about some specialists, like the Indian Journal of Gastroenterology, which is read by gastroenterologists as well as surgeons interested in GI surgery? Or is your manuscript, your paper, such a niche paper that it should go in a subspecialty journal? So I've taken the example of Journal of Radiology. So these are the type of papers, and today all this information is easily available on the internet. You need to know how to look for it, and you need to be patient enough to find it out. There are certain journals which accept, or they are focused on certain types of publications. For example, on the left we have something called as International Journal of Surgery Case Reports. So this journal is only full of case reports. There is something called a Journal of Advanced Surgical Technique, which focuses on the technical aspect. On the right side, we see a journal called Laparoendoscopic Advanced Surgical Techniques. And if you see the bottom part, you will see that there is something called as Videoscopy. So this Videoscopy is a journal which accepts, so the focus of that publication is technique, and it actually accepts videos as submissions. Obviously, the video has to be something very interesting, very exciting, something novel. So this is something that you need to give some thought to. Let us now look at this journal impact factor. So this is an index based on the number of articles which are published in a particular journal over the preceding 2 years, which have been cited by other authors in other journals. So let us take an example of Nature. Nature is one of the highest impact factor journal in the world today and has been for several decades. So how is this how is the impact factor calculated? So you take the number of citations which appeared in the last 2 years, divide it by the number of publications. So citation, for example, now this journal impact factor for 2017 the articles which got published in Nature in 16 and 15, they were 880 and 902. So about less than 2,000 articles. But these articles were so important, they were cited almost 74,000 times by other authors in that same period of 2 years. And that is how you reach this impact factor of 41. I mean, if a journal has an impact factor of 4 or 5 or 10, it's considered an excellent journal. So you can imagine the importance of a journal with the impact factor of 41. Having said that, I would caution you, please do not chase the mirage of a high impact factor journal. For most papers that you or we are going to write, the impact factor of the journal is of hardly any consequence. It does not matter what the impact factor of the journal is. If it has an impact factor somewhere in the range of, say, even 1 to 5, it's a decent journal. A lot of Indian journals have an impact factor which is less than 1. So this is not something that you should actively go around basing your decision off on submitting the paper. The next issue is indexing. So there are two things here. One is there are citation indexing agencies like the Science Citation Index, the Medline, the Scopus, or the Indian Citation Index, which index a particular journal. So the journals scrutinize that journal based on certain criteria and decide that this journal would be indexed with them. On the other hand, there are online digital repository, and the biggest one out of them is the PubMed Central. So PubMed Central gets articles or accepts articles from over 30,000 journals, which some of which are in Medline and most of them are not in Medline. So the purpose of PubMed is to make this research available for people to search through and go through, and that's why it's important. If you look at the Medical Council of India, this is something I picked up from a paper written in an orthopedic journal a few years ago, that from the point of view of career advancement, at least in the government hospitals, in the public hospitals, the MCI recognizes only these indexing agencies, and if your article is published in one of them, then it is considered relevant from the point of view of getting you some extra points or whatever. So it's Medline, PubMed, Scopus, Embase, Index Medicus, and Index Copernicus. So when you're looking at these things, keep in mind that look for an index journal rather than a journal with a high impact factor. All things being equal. And how do you look for whether, how do you know whether a journal is indexed or not? So if you go to the NCBI website, you go to the NLM, National Library of Medicine catalog, you can put the name of the journal and it will tell you whether this is indexed or not indexed. Let us now touch upon the issue of article processing charges. So please remember that a journal functions, journal has to sustain itself. And there are various models on which the finances of the journals are based. So some journals are supported entirely by an association or by an organization. For example, Journal of Minimal Access Surgery for many years was purely being supported by IAGS. They used to fund the bill for the journal producing, say, 8,000 copies and sending it out to the to all its members. Lot of journals would charge the readers for their reading it or downloading a full text article. You may have seen, if you're looking for that odd PDF in a very high impact factor journal, and you go to the website and it says for downloading this you would have to pay about $30 or $40 or $50. So that is the reader paying the charges. And the other model is that the authors pay, not entirely, but to some extent they pay towards support of the journal. So this is a fee paid to make the work available as open access in an open access or a hybrid journal. So hybrid journal is one where some of the articles are open access, the other ones are not. So when can the journal demand these charges from you? So a lot of the journals, when you read through the instructions to the authors or go to the website to submit an article, you have to pay some amount upfront at the time of the submission. And if you see that practice in a journal, it should immediately bring up a red flag, because it means that this journal is simply there to make money out of you. And this journal has no scientific standing or very poor scientific standing in the community. Certain journals will peer review your article without being biased about whether you're going to pay them or not. And if the article is accepted, then it will inform you that you have to pay certain charges for the article to be processed further. There are open access journals which have all the articles open, full text available and online for download and for you to read through. But certain other journals do not have all articles as open access. And at the time of the final acceptance, you will get an email stating if you wish to make this article open access, then you need to pay a certain amount. So this is the optional versus compulsory open access platforms. Certain journals would say that if your manuscript exceeds a certain number of words and if it runs into more than a certain number of pages, then you will have to pay per page charge. A lot of journals would also charge you for getting your color figures or color images in the print issue. This is one practice that one needs to be mindful about it, and one needs to be careful about it. So these are called the predatory open access journals. So they charge you a fee, usually at the stage of submission, for publishing your articles where there is almost no or very, very minimal peer review. A lot of these publication houses have come up from China. There are several of them in the USA. The journal name may sound fancy, but these are basically predatory journals who are only there to publish your articles and charge you money for it. And that's why their standing in the scientific community is very, very low. So if you look at these two websites, predatoryjournals.com and beallist.net. So Beall was the person who was the first to raise voice against them many years back and bring this to the notice of the scientific community that these are journals which are simply there to make money. And if you ask me honestly, these journals are best avoided for your submissions. The next thing that you need to do is to browse through the website or a physical issue of a journal. So on the left side, we have Asian Journal of Endoscopic Surgery, and on the right side, we have British Journal of Surgery. So you have a case report to send. Where would you send it? Now, if you see the Asian Journal of Endoscopic Surgery, the case reports have started. There are almost 15 case reports in one issue, whereas British Journal of Surgery does not have a single case report in this issue. So if you had a case report to send to a journal, you would naturally favor the Asian Journal of Endoscopic Surgery here rather than the British Journal of Surgery, knowing that if it gets accepted, it has a chance of getting published soon. The one thing here is you need to browse a few more issues of that journal before and after this issue to see that they had not put so many case reports in one issue, maybe because there was a backlog of case reports. Sometimes journals can do that. If they have a backlog of accepted case reports and many of them lying in the system, they would make one issue with say 15, 20 case reports, but generally the acceptance or publication would be restricted to about 5 or 6 or 7 case reports per issue. This actually was a paper on the research of submission, acceptance, and publication times in various journals which were otolaryngology or ENT related. And these authors had actually taken the trouble of going through articles over several years, and calculate what was the time between submission and acceptance and submission and publication. Because most journals today, when they publish a paper, they have a footnote somewhere which said article submitted on, accepted on, and published on, publish online on, and you can see which issue it has appeared. If the journal has the habit of publishing this data in the article, you should browse through the issues of journals and compare. Ultimately, as an author, one is interested in seeing that article in print. So if you spend time in studying these journals and say journal A, the acceptance to publication time is 6 months versus journal B, where it may be 1.5 years, all other factors aside, you would probably favor journal A, because if your paper gets accepted, it will actually come into print much sooner than journal B. This is one thing I cannot emphasize enough, that if you wish to submit to a journal, you need to read the instructions to the authors very, very carefully and thoroughly and understand them well. There is nothing more upsetting and annoying for an editor who's sitting on the other side to receive an article which does not stick to the scope of the journal, or has not been formatted or submitted as per the requirements of the journal. I mean, then you have sort of started on the wrong foot. You're started by upsetting the editorial staff, that they have to send the article back to you and say, no, please correct all these things and send it back to us. And sometimes this goes back and forth even before the article is sent to a reviewer for review. So please go through the instructions to the authors. All journals would have these in a detailed way. In fact, I have taken a table from the Indian Journal of Urology, which I simply love. So they are very clear about the various types of the articles that they will accept. And for each of them, what do they expect? Abstract, how many words for the abstract? What is the maximum length of the manuscript in words? How many figures and tables they will allow? And what are the maximum number of references that they will allow? So this is one of the few journals in which I have seen such a nice table available on their website. So if the journal wants you to submit in this format, please respect that, and do not, when they say that, say an original article should be 3,000 words, do not send them an original article which is 5,000 words. Because the first thing that's going to happen is going to come back to you saying, please trim it down to less than 3,000 words. So respect the journal's policies. Next, we will touch upon why do we need to do a literature search before starting to write something, and how does one do it? So you need to search the literature for 3 reasons. One is to get an overview of what has been studied and published in that area already. When you start to write the paper, you will be able to compare your results with those of the others. They could be similar or they could be dissimilar. If they are dissimilar, you need to make an argument or put forward a point as to why you feel your results were different than the others who had published on a similar topic before you. And obviously highlight and discuss the conflicting findings between your results and the other author's results. So for this, we need to get hold of full text articles. And these are some of the avenues of doing that. PubMed is the commonest one, Google search, ResearchGate, and reprint requests. So PubMed, I'm not going to spend a lot of time on. PubMed has some excellent manuals online or video online which show you how best to use PubMed and how to get the articles which you need. But sometimes today, even Google has become a source where you can preliminarily get the articles. So if you say, I'm just hypothetically putting in laparoscopic cholecystectomy, acute cholecystitis, and bile duct injury. You want to look for whether if you perform a laparoscopic cholecystectomy during acute cholecystitis, what effect does that have on the incidence of bile duct injury? So if you just put these words, you will come up with some certain papers. You will need to scroll down these, you will need to refine them, but you should be able to pick up a few articles that you can then look up on the journal websites and download. The next avenue is something called as ResearchGate. So ResearchGate is all people who publish regularly, who are academics, would put up a list of their publications on ResearchGate. So for example, this is the website of Dr. Anil Sharma, who's currently the editor of JMAS. a fairly prolific writer. This was about 4 years back, so about 117 published papers at that time. Today, I'm sure he's got many more. So if you scroll down the list, so you cannot start your search here. You need to identify the article by other means. And if you're not getting a full text article, you need to come to ResearchGate. And often the authors would have uploaded a full text article for those who wish to download it, that they can download. Or you can click on this button which says request full text. And if you click on the button, an email from the ResearchGate website goes to Dr. Sharma's email saying such and such person has requested a full text copy of your article. Kindly send that to him. So he uploads it to the ResearchGate system, and you can go and check on the ResearchGate system and download it. Sometimes you exhaust all these avenues and still you cannot get hold of the article in full text. Reading an abstract does not really mean much. You have to read through the entire article. So one of the very useful tricks is to write to the authors directly. So on PubMed, you will commonly find this author information, and more often than not, you'll be able to pick up the email address from it and write to the author of that paper that you are interested in a reprint of his paper for such and such reason. It's nice to be able to write a few lines as to why you need his paper. You are doing similar research. You are managing a case which was similar to the one that that author had reported. And trust me, more often than not, within a few days, you will get a PDF file of that paper that you can then download and access. This is a very useful practice. But please remember that only downloading lots of reprints and keeping them in a folder is not enough. You need, when you are doing any research, you need to be able to, or you're writing a paper, you need to read through them very carefully, highlight them with whatever way you usually do, and synthesize them, digest them, understand what's being written in them. And that is then the useful way of using these downloaded reprints. So I'm just going to give you an example of how I like to do it. So this was simply for a case report which one of our fellows was writing on a schwannoma in the psoas muscle. So if you downloaded, say, 8, 10, 15 papers on this subject, what you would do is, at least this is what I do, is I go through each paper and pick up the points which I feel would be important to mention in the final article that you're writing, and just make a note of them below that paper's title, so that it's easier then when you start writing the paper to look at this file and pick up the things from here. Mind you, it's never a good idea to copy paste stuff from a paper into your article. That is called plagiarism, and it should be avoided like the plague or like the corona. You have to paraphrase what has been said. You have to understand that material and write it in your own words. And wherever you have picked up an idea or a data from some other author, you need to provide a reference to that. Let us now come to the meat of the substance, meat of this talk, which is what are the parts of the manuscript and what do they each mean. So this is a standard structure of an original article, which is called the IMRAD: Introduction, Material and Methods, Results, and the Discussion. I have just tagged on the last bit of conclusions. So typically, if you look at a well-written article, this is how it will be written in terms of the length. So you cannot have an introduction that goes into, say, 15 paragraphs, or which spreads over 2 pages. So generally, the introduction is 2 paragraphs. Material and methods is about 5 paragraphs. Results, which is the most important section, is about 7 paragraphs. Discussion 6, and conclusion is 1 paragraph. So when you're writing an article, you have about 20 units of thought that you need to compile and put it on paper. These are some slides. The slides that you see in blue are from the talks of my friend Anil Sharma. And this is a very useful way of thinking about a paper. So this kind of a representation is called a spider diagram. So in the center of the spider diagram is the idea, which is the main topic of your paper. So let us look at this and use this as an example, and we will see how it applies to the different sections that are there in the paper. So this was the paper which talked about transabdominal sutures in laparoscopic ventral hernia repair. And the question that they were trying to address is whether that leads to more pain. So what you do here is 4 things. Why did we start? What did we do? What did we find? And what does it mean? So the first thing, why did we start, is the introduction of your paper, where you need to write the purpose of your study, briefly review a few papers on that subject which have been published before. This is not an exhaustive review of literature. You cannot go on endlessly writing about every single paper that has been written on the subject before. The more important aspect of the introduction is identifying and putting forth the lacunae or the gaps in knowledge in that particular area, or if there is any conflicting data in the past which has been published. So that forms the reason why you feel your paper is going to provide some answers. And generally the last sentence of this introduction section reads something like, the aim of this study was, or we report. So this is the introduction part of it. So now talking about our hypothetical question of transabdominal sutures and ventral hernias, let us see under what headings would that author write this introduction section. So he may start off by saying that this is a significant problem, give some incidents as to how often the post-op pain happens, what are the causes of the post-op pain, etc., etc. So that is all that, and for each of these he will provide a few studies which have been quoted in the literature already. The next is material and methods, or what did you do? So how did you select the subjects? What are the inclusion and the exclusion criteria which were used? What was the setting of the study? You have to describe the research design. How did you collect your data and how did you analyze the data, or what statistical methods do you use? So going back to our hypothetical studies, what did we do? A, we obtained ethical approval for conducting the studies. There were 100 patients divided into 2 groups. Laparoscopic ventral hernia repair was performed. And we measured pain. How did you measure pain? By using visual analog scores, number of doses of analgesia, and time to discharge. And the pain, chronic pain, was assessed at 6 months and a year. And certain statistical methods were used for analyzing this data. So here you do not talk anything about the data or its analysis. You are simply writing down the way the study was conducted. Best way of understanding if the material and method section of a paper is a good one or not is the criteria. If you send only the material and method section to, say, another author without the rest of the paper, will that author be able to conduct an identical experiment going through your material and method section? So that is the criteria which is often said to be useful in analyzing whether it's a well-written material and method section or not. Next, we come to the results section. So what did you find? And the results have to be presented in a logical sequence, keeping in mind the topics or the headings which were used in the material and method section. So the results section has to follow the same sequence which was used in your research design. You have to take care that you account for all the patients which you said you studied. There cannot be any mismatch between the numbers. At this point, we do not draw any conclusions or do not try and analyze why some things happened the way they did. You simply have to put forward the data which you got. So let us look at this again. What did we find in this group of patients? So the VAS score in 2 groups at 1 day and 1 week was such and such. the number of analgesia doses which were required were so and so, discharge from the hospitals in 2 groups, did it differ, and what happened to the chronic pain at 6 months and 1 year follow-up. Then you come to the discussion section of the paper, and this is the paper where you say what are the implications of what you've done of your paper. So cover all the debatable aspects of the study. If there are any new findings, new aspects, they need to be highlighted. Perhaps the most important paragraph of this particular section is properly addressing the shortcomings of the study. So if I'm going as an editor, if I'm going through a paper and if I read through the discussion section and there is no mention of any shortcomings, immediately one feels that that paper, that author has not put in enough efforts in identifying the shortcomings of the study and putting them down on paper. Next is the implications for clinical practice. So what are the implications of the findings of your studies and what you have done for the clinical practice? And it's always important and useful to tone down the discussion section. Do not make exaggerated claims in the discussion. Do not make claims which are not supported by the data that you have presented in the results section. So that is an important aspect to keep in mind. So let us look at this hypothetical example again. So what does it mean? What is the implication? How does it fit in with what has been done before? And how does it differ from what has been done before? What are the weaknesses of the study and what are the strengths of the study? And finally, the summary or the conclusion. There are some other parts to a paper like the title, abstract, keywords, acknowledgements, and references. So the title should be representative of the paper and the scope of the study. It should be clear, concise, informative, and one should avoid any abbreviations in the title. The abstract summarizes the study. It can be either a structured abstract, which means it will have a background or introduction, material, methods, results, and conclusion section, or it could be an unstructured abstract, which is typical for a case report, which is just written as a paragraph and you don't really have these subheadings or subsections in an unstructured abstract. Always respect the word limit that the journal has prescribed for the abstract. Usually for an unstructured abstract, it could be as short as a 150 or a 200 word abstract. For a structured abstract, it could be about 350 or 400 or a 500 word abstract. If you pick up a paper, you will always see the abstract as at the top of the paper. That's the first section of that paper which meets your eyes. But please remember that the abstract in a paper, when you're writing it, is always the last section to be compiled. You have to write down the entire paper. So imagine the abstract is like a summary. You cannot summarize a paper when you've not written it. So the abstract is always written right at the end once all the other things are in place. Keywords. The keywords make it easier for other people who are searching for the literature on that topic to find your or pick up your article. So generally journals would ask for up to 3 or 6 keywords or key phrases. It's preferable to use what is called as medical subject headings or MESH. So I've given you a link of this particular website which gives you certain MESH headings. Try and use that, or avoid using words from the title of your paper and repeat them again as keywords. That's not necessary, because the title anyway gets searched when somebody is searching a database. So have keywords which are different from the words in the title of the paper. This is an important issue. Who should be an author on a paper? What are the criteria for authorship? And there are several guidelines on this, and the consensus is very, very clear. Only somebody who has substantially contributed to the conception or design of the study, or to the acquisition of the data, analysis of the data, or interpretation of the data, and he has been responsible for drafting the paper or critically revising it, and he should have seen and approved the final version. What is the meaning of all this? Why do you need to impose such strict criteria for authorship of a paper? The reason is in the last line, that a person can be said to be an author of a paper only if he agrees to be accountable for all aspects of the work and the final print version when it goes into a journal. The people who may have helped you peripherally in writing a paper, somebody has drawn a line diagram, somebody has done some work, but he does not really qualify to be an author based on the criteria which were there on the previous slide. So their names can go in the acknowledgement section, which usually appears towards the end of the paper. The next is you need to quote references for several things which you write down in the paper. Avoid too many references. Again, go back to the instructions to the authors and figure out how many references the journal permits for that particular type of paper, and please respect that limit. So there are two types of or two styles of writing references. The old one was called the Harvard style, where the references were listed alphabetically and they were written in this format. Today, most journals would follow what is called as the Vancouver style of referencing. You can just look up Vancouver style of references and you will get many articles on the net about how to cite references in an article. So we'll not go into the details of that. Lastly, let us come to the visuals, the tables and the legends, the figures, and sometimes videos. So the table should be self-explanatory. They should have descriptive legends or titles with complete information. And a table has these sort of subsections. So you have a table legend, you have column titles, you have the body where you present the data. Please remember, do not make a table with multiple columns. The columns should be restricted to 3 or 4, because anything more than that becomes unwieldy to go through and read. Then there may be some footnotes if you've used any short forms, if you've made any acronyms, you need to explain that. And there are these lines which demarcate one section from the other. If you have figures to submit in the form of graphs, bar diagrams, charts, histograms, make sure that they're good quality, or sometimes for surgical papers, you may have pictures of the specimen, intraoperative photographs, etc., etc. Use legends to explain the key message. Please remember, when you're submitting particularly intraoperative photographs or something that you are very familiar with, take it for granted that the reader may not understand it or see it from the same viewpoint as you are seeing it. You need to make it easy for the reader to identify and understand that figure. So you can have small arrows pointing to structures which are explained in the legend, or you can have a short letter A, B, C, and you can then explain in the legend what A stands for, B stands for, or C stands for. So this is a useful practice. I'm just going to put up 2 graphs to show you an example of what would look like a good graph in a publication and what would be a terrible graph in a publication. You can decide for yourself which is a good graph and which is a bad one. Videos, not all surgical journals would accept videos, but there are some journals which have a specific category of submission in which the video forms a very important part. So you need to figure out by reading the instructions to the authors whether they accept videos or not. If they do, what file format do they want? What resolution would they want the videos to be in? And most journals would put a limit on the size of the file that can be uploaded to their servers. Now, when you see this picture, the SPG or the Special Protection Group comes to mind. But I'm using this simply to remind you that once you've written the paper, you need to be very careful in checking the spelling, the punctuation, and the grammar in that paper. When all this is done and your manuscript is ready, it is not yet time to dash it off to the journal. You need to run a plagiarism check. There are online softwares which you can use for that. Pass that paper to somebody who's more experienced, say a senior in your department, a faculty member, and get them to give you input. So this is like your internal peer review before you send it off to the journal. Most importantly, it needs to be seen by all the authors and they have to okay that article. So you're almost there, but not quite. There are just a few things to take care of, and these are the copyright form. So all journals require you to submit a copyright form which is signed by all the authors, either physically or electronically. There is something called as the author checklist. So if the journal website has an author checklist, you need to download it and go through it very carefully to make sure that you comply with all the requirements of that journal. And there is a declaration of conflict of interest, which either appears as a print version, or today most of the websites, when you submit the article, you would have to tick a box to say that there are no conflicts of interest. Today, all journal submissions happen online. You hardly ever send a print copy of the paper to the journal office. So you need to familiarize yourself with the submission process by going through the journal's website where you plan to send that article. What does one do after submitting a paper? It's very, very important to remember that one needs to be patient. The peer review process takes time. The peer reviewers, the people who review for journals, are always busy clinicians who have decided or who have agreed to spend time reviewing papers as a passion or as an interest. So often it takes time for them to review the paper. So resist the temptation of repeatedly visiting the site to check what the status of your paper is. And most importantly, do not repeatedly send reminder emails to the editors saying that my paper has been with you for 3 weeks, 4 weeks, 5 weeks, and I have still not received a reply. I can understand if you do this, say, after a few months. You may drop in a polite email to the editor if you've not heard from them, say, for about 2 months or 3 months. But generally, this is a habit which is not looked upon favorably by any editor. So once this paper is submitted, there are two possibilities. Well, there are three possibilities. The first one being purely hypothetical, that it gets accepted without anything being changed in it. And that's why I've got it out of this slide. So there are two possibilities. One, that the paper is rejected, or the editor sends it back to you saying that it needs to be revised in a certain way. So please remember this quote, that rejection is nothing more than a necessary step in the pursuit of success. So if your paper gets rejected, that's not the end of the world. You can use the comments which have been made by the reviewers about the paper to actually improve the manuscript if you take into account seriously all the comments which were made, and submit it to another journal. If it comes back from there, you may send it to again another journal. If, however, the comments pointed out some serious flaws, particularly in the methodology of your study, then you need to, at that point, resign to the fact that this is probably not a good study. The methodology is faulty and it's never going to get published, and you need to shelve it. What about the revision? I always feel that just like a rubber band, you need to be stretched to be effective. You have to get out of your comfort zone. When you write a paper, being the author, you are in love with that paper, you feel everything is fine, till somebody points out certain aspects of it which may need revision. So please remember that if you get invited to revise a paper, do not get disheartened. In fact, consider that a very positive sign. It usually means that the editors are interested in your work, but they would want it revised in terms of the word count, in terms of the number of figures, in terms of the number of references, or they're seeking clarifications from you regarding the paper. So carefully note and respond to all the queries which have been raised by the editors or the reviewers. Suitably modify the paper. It's useful to modify the paper and then highlight the sections which have been changed or modified. Always write a polite letter acknowledging that, thanking them first of all, thanking the reviewers and the editors. You want to get them on your side. So thank them by saying that, yes, the comments made by the reviewers and the editors have been useful, and we feel that based on that, the revision that we are submitting is a better paper than the one previously submitted. So hopefully now the editors would consider it for publication. Regarding the resubmission, please remember, do not submit it too soon, because the system of a journal can track the dates of an article, when it gets sent back to an author, when it's resubmitted, etc., etc. So let's say, for example, the reviewers have submitted 8 or 10 or 12 queries on your manuscript and they've asked you to revise it extensively. Such a manuscript going back in a revised format within 24 or 48 hours suggests to the editors that you've not really complied with all those revisions. You've not been serious enough in your effort to comply with the request from the reviewers. So that is not looked upon favorably. At the same time, do not delay the submission of a revised paper for too long. Do not sit on it for 1 month, 2 months, 3 months, because then the editors has every right to just drop it from the system and send you an email saying that it looks like you're not interested in sending us the revised manuscripts, so we are dropping it from the peer review system. Don't let that happen. So this is an example of how you should reply to the reviewer comments. So on the left side, you have the original comment from the reviewer. The central column gives you the reply that you've given. And on the right-hand side, you provide the page numbers and the line numbers where the change has been made. It's often useful to highlight that changed section in a different color, say in red, so that the editors can easily spot that. So finally, I would like to say that writing a medical paper is a challenging but an equally gratifying process. Before you get into the arena, you need to study the game, rules of the game very thoroughly, and that's what you need to do. So please consider the instructions to the authors as your Bible, study it, understand it, and only then start writing the paper. So if you were to ask me in one line, how does one write a paper? The answer to that would be 1 paragraph at a time. Take 1 paragraph, complete it, then move on to the next paragraph, and so on and so forth. And finally, be patient. Remember that all good things in life take time. I'm going to leave you with 2 final sort of points regarding this. And the first of it has to do with the habit of procrastination. You want to write that paper, but fear has gripped you. And what is the fear of? It's usually fear of failure, that your paper may not be adequate, the paper may not get accepted, and you start procrastinating. Once you get into this cycle of procrastination, the next thing that it leads to is anxiety, loss of confidence. You want to make that paper the perfect paper that you can produce. And that goal of perfection itself leads to fear of failure, and the whole cycle of procrastination starts again. So what is the remedy for that? If you ask me, first, keep the long-term reward in focus. So as we said, going back to the first slide, why do you want to write a paper? Or how will you feel when your paper is finally published? So at any stages when you get dejected, when you feel low, keep that final reward in mind, and that will help you to get along this process. The second important aspect of writing a paper is, do not get overwhelmed by the magnitude of the work that you're going to have to put in. Use the tactic of what is called as chunking. You simply say that I have to get the introduction section done. Leave aside all the other sections and the entire paper. Next, you say I have to write only 2 paragraphs of the material and method section first. I'm not going to think today about the results or the discussion or any such thing. So if you divide the larger goal into smaller goals and focus only on that small goal one at a time, it's easier to get a paper done. Although when you look back upon it, it looks like you've accomplished a huge feat. And finally, I cannot stress this enough. At some point, you just have to get started. You cannot simply say or put forward that thing on the next day or the day after or the next week. You have to make a beginning somewhere, and that's the only way you will complete a paper. I want to leave you with a quote, which is one of my favorite quotes. If you've not seen this video, please look up a video called The Last Lecture on YouTube. It is one of the most inspiring 45 minutes of talk that you'll ever hear someone give. So there is a quotation by this professor called Randy Pausch, who's no more, he passed away. And he says the brick walls are there for a reason. They're not there to keep us out, but the brick walls are simply there to give us a chance to find out how badly we want something. And when you're writing a paper, please keep this in mind, that all the difficulties that you will face when writing that paper are there for a reason. They are there to make you a better writer. They are there to sharpen your ability to persevere. And they are there ultimately for you to enjoy the fruits of that paper when it gets published. So thank you very much for your attention, ladies and gentlemen.
Thank you so much, sir, for that comprehensive presentation on how to write a manuscript and touching upon from each aspect of journal selection to submission to looking at how to write different sections of the paper. We have some questions in the chat box, so we'll start taking one by one. So Dr. Ashok Mahapatra wants to know how to find the gaps in knowledge. You have already touched upon that, but if you would like to say in...
Yeah, I think that's something that is, I mean, finding gaps in knowledge has to be to do with the first part of formulating a research question. So it has to be something that you, see, there are 2 ways of approaching this. One is you write when you have something to say. And the other is you write because you want to say something. So unless you feel that the problem, so I mean, you have to start with a common day-to-day problem or a common day-to-day issue that you face in your clinical practice, and you feel that the same problem would be encountered by other people who practice similar surgery. Please remember that most of the research that we do is not really sort of, Nobel Prize winning research. We do not have the facilities, or we do not have the training to be able to do that. So anything that you feel you have a problem with, you can formulate that into a research question and say that, is that something that other people would be helped with? So that has to be the beginning of your research. In fact, I have taken that as beginning of your writing, but in fact, that has to go one step before, and that has to be the beginning of your starting the research project before even writing the paper.
Probably the answer to that question, as sir has very nicely told about 2 approaches. The best one is to read the question and try to formulate the question and look at the literature, what is already available about that, so that in that case we can find out the gaps. That's so nice, sir. There is Dr. Priyavadana wants to know exactly, that question was, what is exactly plagiarism? If I quote them as reference, is it still considered plagiarism? Softwares like Authenticate, Turnitin, where it is 3 words together, also takes as plagiarized. So iron deficiency anemia is also taken as that. So how do you handle such an issue?
Yeah. So I mean, the one thing, as I said, is that when most of these plagiarism software go through your paper, there are certain percentages. Your paper should not replicate stuff which has been written elsewhere by more than 15 or 20%. Now, if something like iron deficiency anemia gets picked up as a plagiarized phrase, it will obviously be at the editor's discretion to say that this is a commonly used phrase, then it cannot be considered as plagiarism. So that leeway you have to allow, or that you have to allow that the editors would see through that. Plagiarism is when we have a tendency to copy paste, and I literally mean copy paste. You know, you would highlight a paragraph or a sentence and Control-C, Control-V into your paper. And even if you then provide a reference for that, that is plagiarism. You need to understand that when you're writing a paper, when you're writing an article, obviously this is not something totally new. You are going to rely on previous knowledge from various sources, but you need to get into the habit of expressing that knowledge in your own words, in your own sentences, or paraphrasing what has been said in the literature. You cannot simply be picking up stuff from elsewhere and putting it into your paper, even if you provide a reference for it.
Right. That's very clear. So now Dr. Vinita D'Souza wants to know, dear sir, situations like journal was indexed in Scopus when the research article got accepted, but the time when it got published, the same journal was not in Scopus list.
Yeah, I don't think I have an answer to that question. Because I mean, this is a peculiar situation. The journals get reviewed from time to time by all these agencies.
Yes.
And for any reason, if the journal standards have dropped below what is acceptable to indexing database, then it has gone out of the of that journal. So this is not a question that any editor will ever be able to answer. It is something that needs to be answered by the editors of that particular journal itself.
Yeah, so probably the selection of journal will play an important role in your manuscript submission before that.
Absolutely.
So the next question is, from a single research question, can there be more than one publication?
Yeah, so I mean, this is something that is called as salami publications. So if you have one research question, or if you collected data, you compile data on a set of patients, and you try and publish multiple papers out of that, that is called a salami publication. And it is generally a practice which is frowned upon. It is not something that is accepted, or it is not something that is looked upon favorably. So there are two things. One is salami publication, and the other equally abhorrent practice is something called as duplicate publication. So please remember that when you are publishing, when you are hoping to publish, you cannot ever submit the same paper to two journals at the same time. You can submit it to as many journals as you want, but it has to be sequential. You have to receive a reply from the first journal before you send it to the next patient, to the next journal. If you ever submit it to multiple journals and one journal, without knowing that you've submitted to the other journal, publishes it, and the second journal also then accepts in publication, that is called duplicate publication. And that is something which is not a happy situation to be caught in, because this can have serious consequences in terms of your reputation, or indeed the reputation of your institution.
Are there any more questions, Sitanshu?
Yeah, there is something. If I submit a paper to an international journal, or can I send it to the editor of a chosen journal directly? See, any research that involves human subjects, or for that matter, animal subjects, has to be cleared by a local ethics committee or an institutional review board. Beyond that, what the requirements are. So in fact, most international journals today would ask you to mention that clearly in your material and method section, that this study was approved by a local ethics committee or an institutional review board. If there are some other criteria which your institution follows, then you need to stick to them. You know, it's best to check with the institution what the guidelines are regarding, because any work which is carried out in an institution typically is said to belong to that institution. So when you are presenting that or projecting that out of the institution, you need to follow the guidelines of the local system.
I think in between I lost my connection, so I'm so sorry for that.
I've gone through all the questions. I don't think there are any more questions here now.
You have covered almost all the questions. That was an interesting session, Deepraj. As usual, your talk was fantastic, and it touched upon every issues. And the last one was the real milestone, that at some point you need to start off. Don't think of failure, because as we surgery, we always think that there will be a failure. You don't start off, then you will just stay back. So at some point you need to start off. Unless you start off, probably you can't never go ahead and do it and fine tune your own mistakes. So that was wonderfully delivered, Deepraj. It was very appreciative.
Thank you.
I think, is there any more questions from anybody? Is there any more questions from anybody? I think.
No, I don't see any more questions.
Yeah, I think ma'am has also answered few of the questions that there are in the chat box. And you also have clarified everything. So maybe next week again at the same time we'll be meeting for another surgical session on bilioenteric and pancreatic enteric anastomosis by Dr. Adarsh Chaudhary. Then we'll be catching up next evening. Thank you very much, Sitanshu, for a wonderful moderation of the evening. Thank you so much, for sparing your time and giving all the insight and how to write a paper. And
I'm happy that you didn't cut me off.
No, not at all. I should not have at all. I mean, it was really marvelous. Everybody appreciated the talk. Mother, we have anything to say? Professor Madhavanand Kar is the head of surgical oncology in AIIMS Bhubaneswar.
So no meeting gets over unless Dr. Madhav says something.
Yeah, this is the excellent coverage from Madam and sir.
Yeah.
When you were asking that, I just want to know that how can we address the journal bias? Suppose some journal is referring the this I am having experience one like that. One journal not accepting, another journal telling that this is the best publication. We should go ahead.
I think bias is inherent in human beings. So, you know, I don't, but as far as possible, I mean, when I've seen, when you say bias, it usually has more to do with the philosophy of that journal or the scope of that journal. You know, you feel that you've sent an article to a journal and they should accept it. But every journal has, or the editorial team has a right to decide what are the kind of papers that they feel which are suitable for their readership. So it's usually a conflict of that idea rather than being a bias towards a particular author or even towards the institution. You know, it has to do with the match of the ideas or the acceptance of types of paper that the editors feel which are suitable for their journal versus what the author feels their paper should get published in a journal.
Arvind, Dr. Arvind, do you have any questions?
Yeah, Arvind, you must ask a question.
Yeah.
So I must thank you and Dr. Sitanshu and Dr. Deepraj sir for this wonderful session, and Madam also. I don't know whether Madam is there or not. Just from bias, I got reminded of a question that is there a real bias against the low and middle income countries authors in the global publication?
I don't think so. See, the issue there again is it's got to do with the topic matter or subject matter. When you have done some research, I mean, as I said, it's your baby, so you're in love with it. You know, you feel that it requires attention globally. Whether a journal abroad feels that the subject of your paper is important enough for their readership or not. See, the editor's first responsibility is towards the readership. Remember that it's not towards the author. they are taking the papers which they feel will interest their readership. More and more readers will read it, and it will be relevant